All right, let's dive right in. Today, we're going to be biological detectives, and our main focus, it's one of the most common, but also one of the most powerful tools in all of veterinary medicine, the complete blood count, or CBC. We are going to uncover the amazing stories hidden inside just a single drop of blood.
I mean, seriously, think about that for a second. A CBC isn't just some boring list of numbers on a lab report. It's a narrative. It's a snapshot, right? A story that's unfolding inside an animal's body, and it can reveal everything from simple dehydration to a secret hidden infection. Our job today is to figure out how to read that story.
You know, every great story needs its main characters. Well, in the story of the bloodstream, we've got three huge players: the red blood cells, the white blood cells, and the platelets. Each one has a very specific job, and their numbers, their condition, that tells us exactly what's going on inside. So, let's meet them one by one.
First up, we've got the red blood cells, also known as erythrocytes. Just think of these guys as the body's tireless delivery service. Their main gig is to carry oxygen from the lungs to literally every single tissue. But they also give us a super important clue about something else: the body's hydration level.
So when it comes to red cells, veterinarians are looking for two opposite clues. On one hand, having too few red cells is called anemia. This can be a sign of blood loss, maybe from an injury or even a nasty parasitic infection like you'd see with Haemonchus in a goat. But on the flip side, having too many red cells is called Polycythemia, and this is a huge clue that the animal is probably severely dehydrated, making the blood super thick and concentrated. It's one of the first and most fundamental things a vet checks.
Okay, on to our next character, the white blood cells. Now this is the body's army. They're the first responders of the immune system. But here's the cool part. It's not just one army. Nope. It's made up of all these different units, and the pattern, which units are being sent out, tells a veterinarian exactly what kind of enemy the body is fighting.
So let's play this out. Let's imagine our first conflict scenario, a bacterial invasion. This could be anything, maybe a wound that's gotten infected, or some kind of internal abscess. It's a focused, localized battle. So how does the body respond?
Well, the body sounds the alarm. The site of that infection starts releasing these chemical signals. They're called cytokines, which is basically a call to the bone marrow saying, deploy the troops. And this results in what we call neutrophilia. It's a massive increase in neutrophils, which are the frontline soldiers of the immune system. They just flood the bloodstream and rush to the site of the infection. So yeah, a high neutrophil count is a classic sign of a bacterial fight.
But what if the enemy is different? What if it's not some localized bacteria, but a full-blown systemic viral attack? Something really dangerous like canine parvovirus. Well, the body's response and the story the blood tells is completely different. It's dramatic.
Instead of seeing more soldiers, we see fewer, like a lot fewer. This is a condition called leukopenia or neutropenia. You see, really vicious viruses like parvo, they don't just fight the soldiers, they go right for the factory. They attack the bone marrow, the very place that makes these white blood cells. Production just grinds to a halt and the cell counts plummet, leaving the body almost completely defenseless. This drastic drop is a huge red flag for a severe viral disease.
Now, beyond the frontline soldiers, the body has specialist units. We're talking the cells that are called in for very specific kinds of threats. You can think of them as the special forces of the immune system.
So we're going to look at three of these key specialists. First, you've got eosinophils. They're the parasite and allergy patrol. Then there are the basophils, which are like the body's alarm system for hypersensitivity. And finally, platelets. Now, they're not technically white cells, but they are the emergency crew that repairs any breaches in the blood vessels to stop bleeding. Super important.
And just like our other characters, their numbers tell a very specific story. An increase in eosinophils, called eosinophilia, points a vet straight towards either parasites or a major allergy. A rise in basophils, that often signals a hypersensitivity issue, like a really nasty case of flea allergy dermatitis. And then there's this one, a decrease in platelets. That's called thrombocytopenia, and it is a huge red flag for certain tick-borne diseases like ehrlichia, which actually go in and destroy these vital clotting cells.
But here's the thing. No single clue tells the whole story, right? A veterinarian has to act like a true detective, piecing together all the evidence from all the different cell types. It's the combination of all the clues, the overall pattern, that really leads to the right diagnosis.
So let's just put it all together. This table really shows how these patterns create a crystal clear picture. You see high neutrophils? You got to suspect a bacterial infection, like an abscess in a dog. You see critically low white cells? You're probably looking for a nasty virus like parvo. A high red cell count? Go check for dehydration. And if you see high eosinophils combined with low red cells, well, that strongly suggests a parasitic infection, just like that goat we were talking about earlier. You see, each pattern tells its own unique story.
It's pretty amazing, isn't it? From just one single drop of blood, we can read these incredible tales of invasion, of defense, dehydration, and infestation. The complete blood count is so much more than just data. It's a dynamic narrative of the body's inner world. And understanding it is absolutely key to protecting the health of the animals we care for. So, the only real question left is, what story is their blood just waiting to tell? Thanks for tuning in.